Eyewitness News Mental Health Check. Welcome back. Thanks for joining us. I'm Brittany Johnson.
And I'm John Paul. This midday, we are focusing on mental health and connecting you to resources. It's clear more people are reaching out for help during this COVID-19 crisis. Text messages to the National Distress Hotline actually increased more than 1,000% last month.
But still, there are too many people who are struggling who don't seek help. Erica Bryant met one man who didn't. He went down another path, but fortunately found his way back.
Yeah, the day after Memorial Day 4 years ago is when I attempted suicide.
Jim Love's emotions are still raw, remembering when depression and bipolar disorder took him to a dark place.
I reached the point where I deeply believed the lies my brain was telling me.
Thoughts that he was a burden to his coworkers, friends, and family, that they'd all be better off without him. So that night, he kept the mood happy, told them all he loved them, and researched a drug he thought would prove fatal.
The opportunity was perfect. I could go home. I'm overweight, a smoker, heart history, dies in his sleep. Nobody will suspect a thing.
Jim says to his surprise, he woke up and then told his wife what he'd done.
I was angry, probably first and foremost, and then I was scared.
Their son Adam was just 16.
You're thinking everything, you know? It's my fault, it's his work's fault, it's mom's fault, it's my sister's fault, like, it's his fault, like, he doesn't want to be with us or whatever, like.
Adam didn't speak to his dad for weeks, but his sister Hannah, who lives in D.C., was a critical support from afar, talking Adam through his anger, constantly checking on Dad, and helping Mom process her confusion and worry.
I said, if I take you to the hospital, will you do something about this? Will you take care of it? And he promised me he would, and that's definitely a promise he hadn't gone back on.
My favorite was...
Jim says the process of getting better is still ongoing.
Now I realize how much I have that's worth fighting for. It is the greatest gift I have ever been given.
And he's touching others along the way, getting suicide prevention training from Mental Health America, and being a listening ear for friends in crisis during COVID-19.
Sometimes that step is just listening and taking them by the hand and helping them get through that crisis and get that professional help as soon as possible.
So how do you know if someone is at risk of suicide? Well, here are some warning signs. Okay, they may talk about feeling hopeless or having no purpose. You may notice an increased use of alcohol or drugs, and they may talk about being a burden to others, or they may sleep too little or too much.
Well, let's bring in Dr. Rabia Hassan back in. She's a psychiatrist with Atrium Health. So Dr. Hassan, I mean, the warning signs here, are they different for children who might be contemplating suicide?
Well, and that is a good question. And it's important to remember that, no two teenagers are alike. But teenagers are different than adults in that they're more impulsive. And so often suicide attempts take place in an acute crisis. So if they've had some conflict with a peer, conflict with their parents. So that's important to be aware of. But other things to look for is if you see a drastic change in personality. Is this a normally calm, cooperative child who suddenly is becoming very violent and rebellious? Or a normally outgoing child who's suddenly becoming very withdrawn and isolative. So those are important things to look for. And also, it's important to remember if a child's making some of the same hopeless statements that you would hear from an adult, saying, negative self-talk, nobody cares about me, I have nothing to look forward to. Those would be some things that you would want to look for.
And this pandemic, it adds a whole new aspect here. So many kids are isolated right now. I mean, they're separated from friends, they're separated from the family. How do we keep tabs on them?
Well, I think it's important that we still emphasize spending time with each other. And so, a lot of kids are spending more time in their rooms, online, checking social media more. So, having some time at the end of the day, maybe taking 10 to 15 minutes for everybody to talk about their day, talk about how they're feeling, and then just doing some family activities together in the evening, maybe having dinner, watching a movie, playing a board game, maybe doing some things that, we did before electronics were so common.
Yeah, some great advice there, Dr. Hassan. Thank you.
And Mental Health America offers free confidential screening tools online for things like depression, anxiety, PTSD. There's also a youth test, and there's another one for parents. You can go to mhacentralcarolinas.org/screening tools. Atrium Health has a crisis intervention helpline where you can call to get connected to resources. Mental health professionals and registered nurses answer all of the calls. That number is 704-444-2400, and it's available 24/7.
With so many people reluctant to go to doctor's offices right now, many have turned to these virtual visits. Scott Wickersham got the chance to have a virtual conversation with an Atrium Health expert to see how those work.
So joining me now is Dr. Manny Castro, the Medical Director of Behavioral Health Integration for Atrium Health. So Dr. Castro, let's talk about virtual visits for mental health care. How much has telehealth for mental health grown during this pandemic?
I think it has grown leaps and bounds. We went from a facility at Behavioral Health Charlotte and Behavioral Health Davidson where we were doing a handful of virtual visits a month, where we were now doing thousands within weeks. So virtual visits has opened the door for us to improve access to behavioral health services across North Carolina and South Carolina.
Certainly for some people it's routine, for others it's very different. Are there certain types of situations or patients that it works better for?
So we've seen this virtual visit platform be very successful with our younger populations. I think the other thing that to emphasize is that for us, virtual visits isn't just the video, but it is also telephonic outreach. We have seen the telephonic outreach be extremely successful for our patients that are a little bit more, our patients that are less virtually savvy. So it's very easy for them to pick up the phone, have a conversation with their providers, explain their situation. We have seen the video uptick more in our millennials or our younger population who are much more computer savvy.
Now, some of the positives from these virtual visits, Dr. Castro says they allow clinicians to actually see the inside of a patient's home environment for a clear picture of how they can help them out. And he says many patients are more comfortable opening up to therapists when they're in their own homes.